Heath Justice Initiative is calling on authorities to learn from the way HIV/AIDS was handled in the early 2000s. The group says there was a time when it was estimated that 600 people were dying every day in South Africa from HIV/AIDS due to government denialism. It adds a lack of political will to find solutions, and pharmaceutical profiteering were factors. The initiative, of course, also weighing in on several other issues. In fact, let's go straight to Fatima Hassan, who heads up the Heath Justice Initiative. Of course, Fatima, when one looks back at the handling of HIV/AIDS in the early 2000s, it's not really a moment where the country crowned itself in glory. Why do you think it's important to look at that period in particular to learn some important lessons?
Thank you, Cathy. I mean, I think, that era, unfortunately, was characterized by a decade of premature death and suffering. There was denialism, as you've correctly pointed out, which was state-sponsored. But that, in turn, led to a lack of political will on behalf of government and the officials that worked in government. And that lent itself, in this ironic way, for the pharmaceutical industry to actually profiteer of excessive pricing and a lack of proper regulation and patent regulation. So the unfortunate situation that we're in relation to COVID right now is that those lessons can become quite an important guiding light for the type of efforts that we need to accelerate, particularly as it relates to government in terms of exercising its regulatory power, exercising its political will, and not relying on the benevolence and the charity or the humanitarian offers of the industry.
When we talk about political will and how that can be more precisely exercised under COVID-19, what do you think could have been done differently? Because the government has largely been praised, at least on its initial handling of the virus. Where do you think some of the fault lines lie now?
So I think the first thing is, credit to government in terms of the biomedical response to COVID. So it hasn't been characterized by denialism of the HIV/AIDS days. So there's a scientific evidence-based response, which is quite significant. And I think that's really because of the leadership of the Minister of Health. But where our government could be doing better is, instead of focusing on regulations about what type of clothes you can buy and when you can exercise, is actually to tackle the barriers that would prevent a vaccine being affordable and available and accessible to everybody in the country. So we need to amend our patent laws. We need to overcome patent barriers. We need to be proactive and preemptively price regulating, not just on vaccines, not just on testing kits, but also on treatment, which we all hope one day in the next 18 to 24 months would be available. So if there was a criticism or if there was a recommendation to government around how it could manage the socioeconomic impact and the affordability issues of COVID sufficiently and also more sustainably, is to actually act now. And like I said earlier, not to rely on the benevolence of an industry that has never really been interested in saving lives. Before in South Africa, it was HIV/AIDS activists that had to take drug companies to the Competition Commission, that had to take them to court to try and bring those prices down, to break down the monopolies, and to also try and ensure that not just one generic manufacturing company was given the license to manufacture a vaccine or a treatment or a drug that could actually save your life.
So, Fatima, if I'm hearing you correctly, what you're really saying is that government needs to be a couple of steps ahead of the process.
Yeah, I mean, if you look at the global developments and you look at the secret, background deals that are already taking place between drug companies and between governments that are hoarding, we call it vaccine nationalism, where countries are buying up the potential of a vaccine supply. We don't even know if that vaccine will work, but they certainly are buying up, the right to be able to have a vaccine for their citizens first. So I think that what we're calling for is that it's lovely to have great press statements and political statements where the president signs on to the idea of a people's vaccine, but that's very theoretical. What we actually need to do is take the the relevant legal and regulatory steps now already, so that if in 18 to 24 months' time we do find an ideal vaccine candidate, we'll be able to ensure that not just South Africa, but the region is able to access it, is able to distribute it, is able to manufacture it, and is able to afford it.
When we talk about health justice, access is also an important issue, and that really seems to be part of where the system right now is likely to fail many people, because of course depending on your income bracket, your class in society, you either have access to good medical care or you're having to simply deal with whatever it is that you're given on the part of the state.
Yeah, and certainly with HIV/AIDS, what we found was that the epidemic and the response to it was very racialized. So if you were rich and if you had medical insurance and you had medical cover in South Africa, you were able to purchase ARVs and you were able to live. Certainly some of my wealthy clients, that's how they were able to survive. But at that time, our poor clients, domestic workers, farm workers, people living with HIV who had no regular means of income, who were too poor to access private medical insurance, because of state denialism and because of the high prices of drugs by these pharmaceutical companies, basically prematurely died. And that's when we talk about the premature death and suffering of hundreds of thousands of our people during the HIV/AIDS epidemic. It's something that we want to avoid with COVID. And if you see the fault lines already playing out in terms of which communities are most marginalized, which communities are most affected by the inability to access a COVID test or to access a hospital bed, that is something that we are concerned about in terms of a successful vaccine product or in terms of successful treatment. So the issue is it's not just the pricing in the public sector. The pricing in the private sector is equally a concern. There are lots of government workers, low-income workers, on low-income medical schemes who rely on private GPs, who rely on private healthcare because of our very unequal dualized healthcare system. We don't have national health insurances yet. So the issue of pricing, is something that we're arguing must be fair, must be transparent, must be regulated, and pricing has to be consistent across both the public and private sector. So we don't have a repeat of the situation we had in the 2000s with HIV/AIDS, where the rich were able to buy medicines to live and the poor basically could not afford life-saving medicines and as a result died.